Good morning, everyone. Good morning, everyone, and welcome to this meeting. Thank you so much for keeping time, and we will also endeavor to do the same. We are seeing people are logging in. And we will start with a word of prayer, and we proceed on from there. So, Diana, you can pray for us.
Good morning, everyone. May we pray. Almighty and everlasting Father, we come before you this morning. We thank you for the gift of life. We thank you for everyone who is represented here, for the institutions. We commit this meeting in your able hands, Lord, that as we start throughout the meeting and to the end, may you cover us, oh Lord, with the blood of your Son, Jesus Christ, that at the end of it all, the deliberations we will have will go into helping our institutions and even our families. We pray this, believing and trusting in your Son, Jesus Christ. Amen.
Thank you, Rita. And just a few rules on how we are going to engage. There is the question and answer button, which you can use to write your questions there. And then for the live session, so that we will respond, you can also use the chat. Later on, we are going to have a section where you can answer questions. If you just move to the next. Yes, so this is what our agenda is. So we shall have opening remarks from our director in charge of public education, advocacy, and rehabilitation. Then you can see that the first on our agenda items, we will briefly give you a feedback on the performance of 2021-2022. I hope you are aware that the scores are on the website, and certificates are going to be produced within the week. And that is because earlier on, institutions had up to Friday, 26th, to raise any issues. So that is why we had not issued the certificates. Then we are going to talk about the indicator for 2022-23, because there are changes, and I know that a number of you have been asking, despite the email that we sent, that you send your draft work plan. There are those who wanted to go straight away and start uploading, and you know that that has not been possible, and that is for a reason. So we will take you through the indicator for this year. We will also do demonstrations on the tools that are provided. Given the changes, it also means that there are things that we need to be familiar with. And then we'll have a question and answer session where you will be given an opportunity to raise your hand and speak up. So at this moment, I would want to invite our director to give her opening remarks. Karibu Daktari. Dr. Lando. Maybe I should, let me see if I can find out where she is, because I can see her logged in.
Good morning. Sorry, can you hear me now?
Yes, we can hear you. Thank you.
Okay, so I'm sorry. I hope my internet will not let us down. I'm seeing we have a quorum, about 300 of us. So thank you for keeping time and for joining us today. This is an important meeting for all of us. The last financial year, we are happy. We noted a remarkable improvement from most of the MDAs. We even had a few who scored 100%, and congratulations to them. And we're hoping that in this new financial year, they will actually maintain the same, even as the ones who had 98 or 90 and above get to 100%. We are here to work with you, and we're here to support you. Please go to the NACADA website. The guidelines are there. When in doubt, always consult our team. Our workplace email is always working, and someone is always monitoring it 24 hours a day. Please reach out to us. We want to ensure all of us give it our best. And if all of us can get to 100, we'll be very happy to support you. So thank you for joining in. Let's learn together and bring all of your questions. Asanteni sana. The meeting is opened. Let's have fun. Back to you, Susan.
Thank you, Director. So now I'd want to hand over to Rita to take us through the first agenda.
Thank you, Susan. Good morning once again and welcome. So I will take us through the last financial year's activities, and of course, to begin with, our objective being to reduce the prevalence and mitigate the negative effects of ADA in the public sector, and that is the main reason why we are having the ADA mainstreaming. So looking at the performance for 2021-2022, in level 1, where most of you were, these are the activities that you are partaking. You have to submit work plan and allocate resources. That is what we were calling the costed annual work plan, and that scored you 10%. You are also to conduct baseline survey, which was 15%. You are to establish and operationalize a committee and have your members trained. It scored you 10%. You are to develop and implement a workplace policy. That was 20%. You are to sensitize your staff at least twice in the financial year. That was 20%. And remember, if you are a tertiary institution, you are to sensitize staff together with the students. Also, for the conducting survey for tertiary, you are to do for both students and your staff. Establishment of support mechanism for employees with substance use disorders scored you 15%. Thereafter, you are submitting your quarterly reports each quarter by 15th of the next month after the end of the quarter, and that scored you 10%. So having looked at your performance for the year that ended, we wish to just mention a few of the areas, gray areas that we were able to spot. And so on the submission of work plan, selection of activities without consulting costed many of you because they were incorrect activities that you put. Some of you picked activities in level 2 when you were basically in level 1. And when it came to submitting of the evidence, you sent evidence for activities in level 1 when you had committed in your annual work plans that you picked activities in level 2. And that is why for this financial year, you will have to share your work plan with us so that we agree together. There were also late submissions of work plans, and that also deducted you some marks. No costed work plan. So if the entire work plan marks was 10%, you are being scored for the work plan submitted online and the costed work plan. Costed basically meaning you had to assign some resources. How are you going to do your activities? And for some of you who indicated that you didn't have monetary resources, please note that resources is not just money. Even the team, the manpower, and even the time is a resource. Then there was also non-compliance with the committed work plan activities, where you committed to do ABCD, but you did just your own things. On conducting baseline survey, we also noted many of you are not using the questionnaires as provided by NACADA on the website. Remember, we have given you guidelines that you follow for conducting a baseline survey. And this includes the questionnaire that are already prepared for you for both staff and students, if it is a tertiary institution, but for the other MDAs, you needed to follow the baseline, the provided guidelines so that you come up with something that is comprehensive. Again, there were many incomplete analysis. Please note that a baseline report has to be comprehensive enough so that it speaks of what came out or what the people are experiencing on the ground. And then on establishing or operationalizing of the committee, we are glad to report many institutions have been trained, and that scored you 10%. And on this 10%, we are looking at these things. The committee, we noted some committees, of course, had not been trained. Others were also using institutions that are not mandated to train you. Only this training can be offered by NACADA. And again, we noted only one member or two trained. In some institutions, remember you need to train up to 3/4 of your committee members. But in some institutions, you have only trained 1 or 2. And this therefore makes your work a bit challenging because you remember you need to capacity build the entire committee. And then submission of unsigned minutes or signed by just one person. One person in the sense that if you are a chair and a secretary, remember the minutes have to be signed by both parties, not just one person. And if they were not signed, then again, you didn't score. Then you are to develop and implement your workplace policy, 20%. Here we noted again a lot of non-conformity of the policy that is not following the guidelines that we had provided. And there you would score half and you are told to review your policy and follow the guidelines. On sensitization of staff, we needed at least 2 sensitizations done in the financial year. And many of you are just doing 1. We noted submission of pictures, registration lists, posters, flyers. Please take note. Going forward, we provide you a list of activities, and on the side, we give you the expected evidence. So when you send loose posters, flyers, the screenshots, they do not count as evidence. Topics of sensitization, sometimes in most of your sensitization reports, they are not included. So you insist this was a sensitization on the policy, whereas the subject you have provided is just sensitization on ADA. So we assume this is just something general. Please provide topics well captured, then memos instead of reports. Some of your reports are so wanting. You are just mentioning, according to PC, this year we were supposed to submit a report, and you're calling that a report. Please note that a report should speak of the topics covered. And at this point, we will also be providing you an outline of what a report should capture, because many of you have been asking, so how should reports look like? Only students targeted and not staff in tertiary institutions. Remember, I have mentioned if you have students, make sure whether it is the policy, it is the survey, it is sensitization, it should speak both of the students and the staff. When it comes to establishing support mechanisms for employees with substance use disorders, there were issues with the fillable EAP forms not being used. I don't know whether people didn't understand. These are just forms that are available on the website. You only need to download the form and tick the boxes. You check the boxes according to the activities that you offered in terms of support mechanisms. It's a very simple form. And this form you needed to submit quarterly, not just one form. The EAP schedule not provided, or again, some of you are taking pictures of your medical cards. That is not an EAP schedule. We don't know about it. EAP schedule, please let us know where your people are accessing these support mechanisms, the services. Whether it's psychosocial support, whether it's those psychiatrists, where are they accessing these people, and what are their contacts, and who are they? Inconsistency in filling the form, just as I said, some people would send in Q4 and you have checked the box for quarter 1. So we don't know this form, is it for quarter 4? Is it for quarter 1? Is it for which quarter? And again, in submitting the quarterly reports, submission of online report with no evidence attached to the report. Remember, the last financial year and even this financial year, there is a place for you. Once you finish filling that quarterly report, it asks you if you need to upload the evidence on the report. So you say yes, then you will have the evidence scanned somewhere in your machine or on your flash, wherever, then you just upload. It is so easier, and we encourage this because this way your evidence cannot be lost, your evidence will be safe. Then submission of unnecessary documents, we repeat, please submit only the documents that you have been asked to submit as per our explanatory notes. Don't send all those programs you keep saying and say that you have captured, you would do sensitization in that program. Please, there's nowhere on our evidences where program is an evidence, not that. Then non-responsive to reminders. Sometimes we go through what you send and we remind you what you have left out. There are emails that we send to people that are never responded to. And you wait at the end of the financial year and then you start saying, we did not talk to you. We talk to you. When we send you an email, please respond. And another challenge comes in when you use more than 2 people to send your evidence. So it is that inconsistency. We don't know who is really reporting. Then having each quarterly report submitted by different persons, that's what I've just explained. So in level 2, those were activities for those people who are in level 2, in level 1, sorry. So in level 2, you needed to submit annual work plan again and allocate resources by 30th of September. You are supposed to train your supervisors and managers on workplace-based prevention interventions for MDAs, and for tertiary institutions, you are not training supervisors and managers, you are training the student welfare staff. There was some bit of confusion there, but many of you reached out to us and we clarified to you. You are also to implement ADA prevention policy. You are to sensitize staff and families on positive parenting, which scored you 20%. You are to strengthen social support through peer and informal referral, that was again 20%. And you are to submit quarterly reports and the evidence. So let us look at some gaps that were identified from there. So again, late submissions of work plans, no costed work plans, non-compliance with the submitted work plans, whereby whatever you have committed is not what you are even doing throughout the financial year. Remember, when it comes to evaluation, the evaluating committee opens your work plan and looks at what you have written in there. So when you go doing something different from what you committed at the point of filling the annual work plan, then you will definitely lose marks. Then when it comes to training supervisors and managers, the supervisors and managers not trained or trained by other bodies again was not recognized. The certificate was not recognized. Supervisors and managers were to be trained by NACADA. Then for student welfare staff not trained or trained but not in work plan. Again, we insist, even if we have trained you, it is upon you to send us those certificates as evidence of training. Remember, we are a big number, we are like around 400 of you. And so sometimes if you are trained by our regional offices and they have not brought that to our attention, we might not really know. The evaluating committee, wherever they are seated out there, might not really know that you are trained either by Central or by Nyanza or whoever it is. So it is always fair that you do not assume. Just send the evidence as per what we require. Then implementing ADA prevention policy, there was non-compliance with activities, again, signed up. On sensitization of staff and families on positive parenting, registration lists without reports. And this goes out to tertiary institutions. Please, make sure your registration lists are speaking to the sensitization report. Many of you send a lot of registration lists, some of which the topics are way out of it. Hello? Sound imeenda? From where? Kasema no sound, they can't use it in the program. Hello?
Yeah, the sound is back. So maybe you go back.
So you can hear me now?
They can't.
It's back, huh? So let me take you back to, sorry for that, you lost me here. So let me take you back to the feedback we got from the level 2 activities. I start afresh. So you were to submit the annual work plan and allocate resources by 30th of September. So what we identified as gaps were
Continue. Continue with this.
sorry again, the sound issue. So let's continue. I hope you can hear me now. So I'm training supervisors, the supervisors and managers, some not trained, and others who are using other bodies that are not recognized. Then the student welfare staff not trained, many tertiary institutions so far have not trained, others trained but not in work plan. You did not commit at the beginning of the financial year that you will train the student welfare, then you ended up training. So in this case, you will be scored for the activity that you captured in the work plan that you will do, and you lose marks on that training. Then implement ADA prevention policy. There was non-compliance with activities that were signed up. Then sensitization of staff and families on positive parenting. The gaps identified, registration lists without reports. Many people are not writing the sensitization report. Then the activity, of course, not done was another gap. Then strengthening of social support through peer and informal referral, which scored you 20%, where there were fillable EAP forms were not being used. Then the EAP schedule not provided, and where the challenge we had with this, people were confusing the EAP schedule with the EAP form. These are two different things. So you needed to have done both. You needed to have sent the EAP schedule, and you needed also to have sent the EAP monitoring form, which is fillable form that you download from our website. Then the training of peer educators by non-approved entities that were not recognized. So you are going to submit your quarterly reports and evidence, you score 10%. So if you submitted within the timelines, you score your 10%. Then submission of unnecessary documents was also another challenge that we witnessed. So at this point, I would just like to repeat, please submit that which we have only indicated as evidence or indicators. On our website, we have written there evidence/indicators. So at this point, I wish to hand it over to Susan to take us through the ADA prevention indicator for 2022-2023.
Stop sharing.
All right, thank you, Rita. I can see so many hands up. I don't know
Remember to use the chat. We are only using the chat at the moment, so you can put your hand down. We are only using the chat. We will have a section where we will take questions. So at the moment, just put your hand down. And if there are issues, then the chat, there are people here who will be checking out to see if there is a challenge. So now I would want to take you through the indicator for this financial year. On the chat, I've also seen somebody saying, please share the recording. I would rather that you pay attention right now, take notes, because if you wait for, tendency is, if you know that there is, it's going to be shared, then you don't pay attention, hoping that you are going to use it. But more and more, you find that chances that you will not go back to the recording are also very high. So we are going to share. Yes, you need not worry. We are going to share the presentation, the recording. Everything is going to be on the website. But it is better if you listen to what is going on. Take note. If you have questions, then you can also bring out the questions after that. Now, the reason why we must go through this first before you submit your work plans is because there are a number of changes that were made. And that is because there are preliminary activities which you need to undertake that will attract no score. And at the same time, if you do not do them, then it means that you will not be evaluated. So it's very important that you take note of that. So there are certain activities that you need to do that will have no score. So those who are in level 1, these are your preliminary activities. You are supposed to develop your annual work plan and allocate resources for implementation. So submission of this work plan will be 30th September. But in the meantime, we want you to send your draft work plans to the email that we use to communicate to you about this. workplace@nakada.go.ke. That is where you submit your draft work plan. We have received quite a number of emails and calls of people who are saying the work plan is not active on the website. And that is because you are doing the opposite of what we expect you to do. So you need to develop your annual work plan, send the draft to us. And so once we give you the go-ahead, that is when you will be able to upload it. So this time you are not going to upload directly. We have to verify your work plan before you can upload it. So that is activity number 1. Number 2, it's to establish or reconstitute and operationalize the ADA control committee and also train the committee. Remember, you need to train at least 3/4 of the members of your committee. That is because if you attempt to respond to this indicator without training, then you will find that you will be stuck. So that is why it's important that the committee is trained. The good thing, in the last financial year, many institutions had trained. So it means that in the case of training the committee, if you have already trained the committee, then you will not pick on the second bullet. But operationalizing the ADA control committee, because you're supposed to have quarterly meetings. So you will still be able to tick that. And the third one is sensitization of staff and students in the case of tertiary institutions on alcohol and drug abuse. And this is not just ADA, but we also have other matters that are related to alcohol and drug abuse. So these are preliminary activities that will be in your work plan, although they will not score you. But at the same time, if you do not do them, then it means that you will not be evaluated. So I hope that is clear. So these are the core activities. So you're in your work plan, you're going to have preliminary activities, then you have the core activities. So in the core, you have 4 activities. So the first one is to undertake a baseline survey on alcohol and drug abuse. The situation analysis and the guidelines are provided on the website. On this call, we also have the research department. So if you have any questions, they will also be taking the chat. But at the end, we will give you a chance to ask questions, and therefore, if there is need for clarity. So if you undertook the baseline survey, for example, tertiary institutions you did for staff but not students, then it means you still have baseline to undertake, because it needs to be for staff and also for students. So the support that is provided, the guidelines are on the website. The questionnaires are also on the website. I know sometimes people say the questionnaire is too long. Remember, you only do one survey once, and it needs to be comprehensive. If you do not do a comprehensive survey, you're going to get stuck when you move to level 2, where there is implementation of the same, as we are going to see as we go along. So that is activity number 1 at 30%. The 30% need to be distributed across the 4 quarters. Okay. Activity number 2 is development or review of the workplace MDA prevention and management policy. That is at 40%. The support that you require is on the website, and that is the guidelines for policy development. And you do know that during the training, even the review of the policy is done. And that is why if you have not trained your committee, you are going to be at a disadvantage and may not be in a position to adequately respond to this. So if you still had a draft in the last financial year, you still have this target on you. So you are going to now review or finalize your policy. So do not be in a rush to move to the next level. It's not about levels, but it's about completion of certain activities. So if you are new, it means you are developing the policy. If your policy was not complete, you are reviewing the policy. If you reached draft, you are finalizing the policy. So that is an activity that you need to take at 40%. Again, distribution of the same 40% across the quarters. Number 3 is establish and operationalize support mechanisms for staff and students in the case of tertiary institutions with substance use disorders. So we are saying that here we are talking about those who are already experiencing problems. And the support that is provided is the EAP guide, and then the fillable reporting form, which is provided on the website. So before we finish today, we shall have also demonstrated what this EAP guide is and what the fillable form, so that when it comes to submitting your evidence, then you do not confuse both the schedule and also the forms. And then activity number 4 is to submit quarterly reports and evidence through the online system to NACADA. The 10% is also distributed across the 4 quarters. And the guidelines and forms are available on the website. We are going to demonstrate those, the forms, how it's supposed to be filled. Remember the changes that have been made. So pay keen attention. And then after that, that is when we are going to upload them. The reason why we have not made them active is so that we do not have people making errors. So if you are in level 1, you're supposed to have preliminary activities and then the core activities. So you'll find that these 4 activities here add up to 100%. I hope that is clear. Then In terms of what will we be looking for? What will we be looking for if you are going to submit evidence and so on? So in the first one, remember the preliminary, no score, but still must be done. So you need to submit your work plan by 30th of September. What are you supposed to submit as evidence is the costed annual work plan in the prescribed format. Yeah. So this work plan is submitted using the form, and the costed work plan is attached as evidence. So if you submit it last year, it's going to more or less remain the same. So you need to submit a costed work plan. As Rita had mentioned, sometimes people submit the online one, then they do not submit a costed work plan. Or what they do is to send the same one. If you receive a copy of what you have submitted, but we also receive it. So you don't need to send it to us again. So sometimes people send that, and then you assume you have sent your costed work plan. So for committee, if you are reconstituting or establishing a committee, then you need to provide the letters of appointment of either an established committee or a reconstituted committee. Then the signed minutes. Quarterly meetings are supposed to be held. So as part of evidence, you're going to send signed minutes. Do not send minutes that somebody, you can just see somebody is working on it on the drive and then sends it because you are supposed to fill it in. So for those who have not trained 3/4 of their committees, you can see that you will still need to do the training. And the training will be done by NACADA. We will talk about that later on. And it is something that you need to do. So if you have been trained, you will be given certificates, and therefore you need to submit the certificates of those who have been trained. Number 3, still on preliminary, is sensitization of staff and students. You're supposed to conduct 2 sensitization forums, and you can see the sensitization forum, the reports and the registration list. So this time round, we are going to post a template for the report on the website as guidelines, so that we don't have people who do screenshots and just writing something at the top there to show that it's a report when it's actually not a report. So now you will find a template for the report, everything available at the same spot as we shall show you later on. So for the core activities, if you are undertaking the baseline survey, it is not enough to do the survey, it must also be disseminated. The findings must be disseminated to all staff and students in the case of tertiary institutions. So what will we be looking for? A letter of engagement for the survey. Because you know that for the survey, you can do it in 3 ways. 1, you can engage with NACADA, and our research department is represented here, so that if you have any queries on that, they will be here to respond. So you can engage with NACADA. And of course, there has to be a process, so you will have the letter of engagement. You could also do it internally. As tertiary institutions or even MDAs with capacity, you can do it yourselves. But remember that there has to be evidence of this being done. So there must be even a memo that is sent to all staff indicating who is doing the survey, when it is going to be done, and so on. So that becomes evidence on the letter of engagement if it is being done internally. Alternatively, you could also be maybe through your processes, you engage with consultants. So it means that there also has to be a letter of engagement. So I hope that is clear, because there are 3 ways in which you can do that. You must submit the report of the survey. Not some, analysis. Some people just send charts, and there is no analysis. That does not give you a report. Because even later on, you can't move to the next level of implementation because you are going to see what then happens with the survey. That survey, you don't just do it and keep it. So that's why it's very important that you have a report of the survey, not just screenshots or pie charts and graphs that then is not analyzed. Then there has to be dissemination. So when you disseminate it to staff, you collected data from staff, you collected it from students, you need to also present back. So we need to see the dissemination report. And so that means should come alongside with registration lists, because then it shows how many staff were sensitized, what were they sensitized on, and so on. And that includes also for the students. In the case of the policy, a policy is not a one-off thing. And some of the people who have sent draft work plans, somebody puts all the 40% in one quarter. That is not possible. It has to be distributed because for you to be developing or even reviewing the policy, there has to be meetings. So if you are having drafting or review meetings, then there has to be minutes for that. Again, once you have done the policy, it doesn't come from the review team to management. It must also be taken to staff. So staff needs to input. And so when you are presenting it to staff, then it means there has to be minutes showing that this was done. And then a copy of the policy. Please take note that we literally go through that policy. So if we say your policy is not in line with the guidelines, it means you are not following the guidelines. So, and if it is not complete, you can't move to the next level. So if your policy is still in draft, just remember that this is an activity that you are still doing in this financial year. For establishing support mechanisms for employees with substance use disorders, you need to provide a schedule of the EAP services available or those that are offered. So whether you are using a service provider, for example, Jubilee, Old Mutual, and so on, please provide the schedule of services that are available on that, with that service provider. If you are using, like those who are using NHIF, provide a schedule of the services that NHIF is covering. If you have in-house, like in the case of tertiary institutions, you could even be having for counseling services or other health related matters for students, please provide that schedule. That is what it means, a schedule of services provided, and it is done every year. So because you know that these expire or some of them, if there is even a review, so you need to provide the schedule of services. Then the EAP utilization report. Now that you have the services, who is using them? And that's why you see the aspect of sensitization on the EAP services available. Part of the reasons why people do not present themselves or there is no utilization is because people don't know about the services that are available. So there is need to do sensitization for the EAP services available, whether it is to students or it is to staff. And then in the utilization report, that is where we have the fillable form, which is available on the website. How many staff and students have been referred for counseling and for treatment and rehabilitation? We need to see that. And so you do not send us a letter. As we saw in some cases, a letter, somebody says, this person you have been identified as having alcoholism, and so you are supposed to go for the treatment. Failure to reach disciplinary action will be taken. Yeah, that already indicates that you don't have a policy that is addressing a health and safety issue, but punitive. Remember, the policy is not supposed to be punitive. So when you write such a letter, it's very clear that the policy does not exist, and that is the reason why people will not even take up the service. So I hope that is clear in terms of support mechanisms. Then submission of quarterly report. The quarterly reports is the prescribed format, which is not active until we have taken you through it. Submission of evidence, remember, you can attach or is supposed to attach the evidence on the form. So it means that before you start filling, you must have had this evidence together. And it's very important that you also go through this evidence with your committee members. That is why you have a committee. Otherwise, if this is not done, then you forget. But should you forget, then send the evidence for that quarter properly labeled to workplace@nakada.go.ke. Now we still have people who just send CAM scanner, doc something. You know the way it comes from the scanner is the way it is sent. Yeah, that is the way it is sent. That is not, it's not helpful, because then it means that even your evidence can get lost. And sometimes it's not even labeled. You don't know which institution it has come from. So it's very important that we do this. So for those who are in level 1, remember, being in level 1 does not mean that you have failed. No, it means that you have not completed matters of baseline, you have not completed matters of policy, and you have not completed, you have not established support mechanisms. So you need to do those 3 before you move to level 2. So this is what we have in level 2. I don't know why there's a lapse in. Okay, there you are. That is preliminary activities for level 2. So again, remember, if you're in level 2, you must do these 4 activities, but they will not attract a score. At the same time, if you don't do them, you will not be evaluated. So there are things which are compulsory. So submission of your work plan and allocate resources for implementation. And like I said, submit at this point. You will not get to upload it on the website until we have given you the go-ahead. So your responsibility right now as a committee is to do the draft, send it to workplace, email, and then once we give you the go-ahead, then you will be able to upload. The second one is operationalize the ADA control committee. Remember now, if you're in level 2, it means you have already trained the committee. And so you don't need to establish the committee or even train the committee, but operationalize the ADA control committee. That means that you will be having quarterly meetings, which we need to see the minutes. The other activity that you need to do is to train managers and supervisors on workplace prevention interventions. That is for MDAs. For tertiary institutions, the training of staff in charge of student welfare. Or training of peer educators. That means you must have moved to the 3rd level of training. So where it is applicable, if you have peer educators or coming from your survey, there is need to have peer educators, then you can see that you will need to train peer educators. So it means that if you check the box that you need to train the peer educators, and that will be done. So that is for MDAs. Yeah, that is for MDAs. Now, when it comes to tertiary institutions, remember the training of peer educators is going to come much later, and the peer educators now will be students. It will be students, but not in this financial year. Okay, so take note of that you need to train either supervisors and managers, although we had some institutions who already trained in the last financial year, and therefore you don't need to train again. So you will see what needs to be, what you are going to do with regard to this. So when it comes to demonstration, then it will be clearer for you. So if you had trained managers and supervisors, you don't need to train again. If you have already trained the student welfare staff, you do not need to train again. But we also have 2 institutions that in the last financial year already trained peer educators. And they know themselves, and so it means that we not need to do that anymore. And of course, for those ones, we already built capacity so that they can also do the same within their own institutions. Then there is sensitization of staff and their families or students on ADA, and that includes even the positive parenting. So those are the preliminary activities that need to be done by those who are in level 2. Let's see the core activities. So if you are in level 2, these are your core activities. And you can see that is why we're saying if you have not successfully completed your survey, you will not be able to do level 2, because in level 2, you're supposed to implement interventions to address 2 risk factors identified in the baseline survey. So if your baseline survey, if your analysis is not complete, you will not be able to identify 2 risk factors. So you need to specify the 2 risk factors and then 2 strategies to mitigate them. If you are in a tertiary institution, because you have 2 levels, you have students and you have staff, then you need to identify 2 risk factors from the staff survey and 2 risk factors from the student survey. And then, how are you going to mitigate? So that also needs to be clear. So if your survey was not well done, you can see how you will be returning back there. Now, let me say something about the 2 risk factors. There are people who, from some of the drafts that we have seen, somebody says mental health. So risk factor is mental health. What about mental health? You need to say something, put a full sentence about what the risk factor is. Some of you have done very well, like somebody says, lack of management support, yeah? Lack of management support as a risk factor that came out of the survey. So how do you want to mitigate this? Then there could be need to train the managers and supervisors, because from the survey, it is showing that there is lack of management support. So it means that these managers and supervisors or management either need to be trained or they need to be sensitized. Remember, if it is training, it is a 3-day. It's a 3-day affair. If it is sensitization, then it should not be less than 1 hour. All right. So identify the risk factor, and then how do you want to mitigate? But you cannot have everything is mental health, everything, staff, student, mental health, unless people have gone cuckoos in your organization. And so you will be saying mental illness. Yeah. So if it is mental illness, then now you can talk about how you want to mitigate. So don't just say mental health. What is it? Remember, alcohol and drug abuse issues are already mental health issues. So don't just say mental health. What did the survey show in terms of that? You don't just say workplace stressor. What about workplace stressor? Because if you just throw in 1 word or 2, then strategies on how to mitigate them is going to become a challenge. And remember that the strategies to mitigate are in the policy. So that is why if your policy is also not complete, then you have a challenge in coming up with strategies. So I hope that is clear for those who are at this point. I know some of you, we've gone back and forth until we stopped and said, let's wait for this sensitization. And that's why we also said you need to have more than 1 person in your institution attending this sensitization so that you can help one another. Activity number 2 is to implement the MDA prevention and management workplace policy. This is not a policy you develop and keep. It is a live document. And so your workplace policy, if you are going to implement, then it must target those 3 areas: whole workplace, at-risk population, dependent population. So if it is missing in your policy, it means you will have a challenge moving forward. So you need to specify the strategies for whole workplace, the strategies for at-risk population, and the strategies for dependent population as provided in your policy. So when you engage with us and some of those parts are missing, then that is why we are providing guidance. But remember, it must come from your policy. If it is lacking in your policy, then it means your policy requires review. And so you are better off in level 1, reviewing the policy so that it is comprehensive. If it is not comprehensive, then you will not be able to move forward here. And remember, it's not us who are telling you this is whole workplace, this is at risk, because during the training, this was done. And each one of you who attended training, you have a manual. So that is why we're also giving you manuals. So go back to the manual and see what were the strategies for whole workplace, for at-risk population, and also dependent population. Even those who undertook online training, before every lesson, you are given a manual. Yeah, you're given a manual. The only difference is those who come for in-person training, you are given one whole manual at the same time. But those who do online, you are given in lesson 1, you are given a manual. In lesson 2, you are given another part. In lesson 3, until you come to the last one. So each one of you has a manual. Please use it. Please use it so that it helps you to identify that. But remember, and that's why I was saying it's not about wanting to move to level 2. If you have not completed those things in level 1, you will not be able to pick up activities for activity 1 and activity 2. So again, the 40%, the 25% distribute across the quarters. Activity number 3, which is 25%, provide support for employees at risk and those with substance use disorders. Remember, these are people who are already experiencing problems. In level 1, you are establishing support mechanisms. So in level 2, you are now implementing what is there. And that is why you can see you will use the guide and the fillable form because there has to be uptake of the EAP services. And then what other strategies are you going to use to increase utilization? It's about utilizing what is already existing. Remember, we are not saying that you come up with a new thing. You are already having that. So whether they are psychiatric services or counseling, we are going to talk about that shortly. So that is activity number 3, and number 4 is submission of quarterly reports and evidence through the online system. It is expected that we are supposed to give you feedback at the end of each quarter, but we cannot give you feedback if you do not even submit evidence or even do the timely submissions, because remember, submissions are supposed to be by 15th of the following month, yeah, preceding the end of that quarter. So that if we are in quarter 1, it means that by 15th of October, you should have submitted. And sometimes we give feedback and say, we have received your quarterly report. but you have not attached evidence. End of story. You don't hear from that person again. Then the next time a different email is used or a different person submits. So consistently, we are already warning you that you have not submitted your evidence and consistently you do not respond. Then at the end of the year, you are convinced that we did not even respond to you. So we are also going to remedy that in this financial year. All right, so what are the evidence? What will we be looking for when it comes to level 2? Posted work plan that applies to all. The second one is the committee. Remember, you are operationalizing the committee, so signed minutes of quarterly meetings. And I would want to say that we have also indicated that the committee needs to be in place for 3 straight years. I know during trainings, some, especially every year, it means every year you'll be at level 1 because you'll have to train the committee. So it means you'll not be able to move forward. So that committee needs to be in place for at least 3 years to be able to implement all these things that we've talked about. Because you can imagine if you have a new committee every time, they will be new to all these things all the time. And so it means that you will never move from level 1. So if you have trained, if you're training managers and supervisors, student welfare staff, or peer educators to improve the peer support, remember that the peer educators, the training of peer educators is aimed at improving the peer support among staff and students. So if you check the box for training, then it means that you need to provide copies of certificates. Now, in the case of sensitization of staff and their family members, remember that the topics are derived from the survey findings. So that is why you don't just send a report and say, we did sensitization of MDA. What about MDA? It has to be from the topics, because sometimes you find that maybe from the survey, part of the risk factors is even the issues of per diem. Yeah, the issues of per diem. So how are you going to mitigate that? It could be lack of information. So if it is lack of information, then it means that on the effects of alcohol and drugs, then that means that your topic of sensitization will be on effects of alcohol and drugs. And you can see sensitization should be done at least twice per year. And so you submit the reports with the registration list. Don't submit registration list minus reports. Let's look at what we will be looking for in the core activities for level 2. Like we said, specify. I know some of you just write implementation plan. No, what is in the implementation plan? You need to specify upfront the 2 risk factors that you are going to address and the strategies to mitigate the 2 risk factors. In the case of tertiary institutions, specify 2 risk factors for students, 2 risk factors for staff. So don't just write implementation plan. This is the plan. The plan is where you're talking about the 2 risk factors and the strategies to mitigate it. So in the case of implementation report, like I've mentioned, a template is going to be provided so that you indicate what is it that you are addressing and then how have you, because your mitigation, is it sensitization, is it training, is it whatever it is that depending on the risk factor. Because for example, if it is financial management, I know you may not know how financial management is related to ADA, because if you are under a lot of pressure and you can't deal with your brokenness, yeah, the month has not ended, but the money has ended, and yet it is supposed to be used for the whole of next month. So it means that people require then sensitization on financial management. So that's why we are saying the topics are informed by the findings of the survey. So those who are asking questions on this, I hope now this clarifies. And again, we need to sit as a committee because we've seen one person is the one who is responding. We tell you do this and quickly you respond back. Sit down with your committee members so that you decide on what you are committing to. So number 2, in implementation of the policy, remember you are implementing the policy to address those 3 things. Whole workplace, that is the universal population. At-risk population, that is the indicated population. Selective population. And then you have the dependent population, which is the indicated population. So again, this specify the strategies that we are going to do for those 3. And that is what it means by implementation plan. And then when it comes to the report, you are going to have the template that we have already mentioned. So those of you who, like I said, if your policy is not complete, you are not able to identify risk factors, back to level 1 so that you can successfully complete that. So for support mechanisms, provide support for employees at risk and those with substance use disorders, you can see submit the schedule of services, EAP services. Sensitize these at risk and those with substance use disorders. Have sensitization forums for the EAP services and also the fillable form. So you cannot have, I know some of you are having EAP for number 1, you want to have EAP for number 2, you want to have EAP for number 3 now. EAP is only for number 3, and then submission of the progress reports as provided. So then what do we mean by an EAP guide? For purposes of clarity, what is EAP? EAP is Employee Assistance Program in full. An Employee Assistance Program is simply the benefits that employees and even students have. It's a benefit program. It already exists. It's not like you're creating something new. It already exists. Yeah. And it is aimed to assist employees with personal problems because your personal problems become work problems. What happens at home is going to affect your workplace. So it is a benefit program that is supposed to assist employees with personal problems and work-related problems that may impact their job performance, their health, their mental and emotional well-being. So that is what EAP means. And I'm sure now if you reflect back, you can see you already have it. It's not like we're asking you to do something new. These services can be provided internally because you either have a health facility or you have counseling, like those who are in ministries. You already have such kind of services being provided for at, I think it's Nile House. You already have also NHIF. So that means that you have a hybrid. Yeah, that is what hybrid means. You have something which is internal, but you also have an external. So internally, you could be dealing with all these things internally because probably you have a hospital. And so everything is dealt with there. You could also be utilizing a medical service provider so that if you have liaison, Jubilee, AAR, whichever, it means that your medical service provider is catering for all this. Or it could be hybrid in the sense that you have those services that are handled at the institutional level, but you have those ones which are the staff can then access from outside. For example, if it is rehabilitation, there's need for rehabilitation, then you send them to rehabilitation services. Or it could be that your medical service provider takes care of everything. Yeah, like if you have NHIF, it takes care of all those. So we are talking of either internal, a service provider or a hybrid. And this is what it includes. We're talking of counseling. We're talking of psychiatric assistance. We're talking of treatment and rehabilitation, which can be outpatient or inpatient. Remember, treatment and treatment is not necessarily inpatient. Even outpatient just works as well. And outpatient includes other places like even KNH. So we have treatment and rehabilitation, and then we have aftercare for relapse prevention. These are the services that you find under EAP. So for those who have been asking questions, now what is this EAP? It is probably because you have not gone through training and therefore you have no idea, and you are trying to fill a box which does not make sense in your head. So that is why it is very important that you have the trainings. And therefore, EAP schedule is an outline of what services, where, when you can have it, who is offering it, and how of those services that are provided for them. So that is it with regard to the indicator. I have moved slowly so that if you have questions, then you can ask questions. And I can see more and more people are still asking for presentation. Tafadhali, pay attention to what is going on now, so that later on, when you get the presentation, it makes sense. Otherwise, you will have the presentation and still have challenges. Okay, so at this point, I want to hand over to Diana, who can take us through she will take us through the tools. I hope you are taking note of questions, because once we are finished, then we will give you time to ask questions. Those who are carrying up your hands, just put them down, use the chat for the meantime, and then you will ask questions later. But we are also responding to the same via the chat. So use the chat to ask the questions. Otherwise, these items are going to be on the website. We will not send to your email addresses. We will post on the website. So that, because that is your one-stop shop for everything. If we send to the email, the next time you'll be asking, where can I get this? So that is why everything is put in one place. So thank you very much, and I'll hand over to Diana.
Thank you, Susan. So now we'll go to the next session, which is just giving you a demonstration of the forms and where to get information from. I will begin from our website. Most of us call or find out from different people, where do we get this information? Where can we access the online things that you're telling us? Where can we access the documents? We kindly request you to go to our website. That is www.nakada.go.ke. When you go there, this is what our homepage looks like. So once you're on our homepage, kindly go to InfoHub, and you'll see the drop down at InfoHub. Then you go to Public Sector and click Public Sector. Once you click Public Sector, you'll be able to see the screen that reads Public Education and Advocacy. Kindly note that when you scroll down to this, it gives you all the documents that we usually refer you to. All the documents, beginning from the explanatory notes for this year's guidelines, which is very important. As you can see, it is there. And we urge you to kindly ensure that you click on this document, read it to understand what is expected of you, the activities you're supposed to carry out, and the evidences that is required. So please note, visit our website. As a committee, familiarize yourself with our website. It will help you understand a lot of things. As you can see bulleted there are a number of items. We shall be loading the work plan once we are done with these presentations.
The quarterly work plan is also there. So it's a matter of going there, clicking and filling in the information that is there. You can see the EAP monitoring tool that most of you are asking, which tool is this, is there. We have the policy guidelines for those who have not completed the policy, and for those who are telling that your policy is not in line with the guidelines, it is there. Please click, find out what the guidelines is saying and use it. The baseline guidelines is also there. The questionnaires for both students and employees is there. So please ensure to visit our website to get all this information. Right now, most of you are asking for these presentations. They shall be put there. The only sad or unfortunate bit is that most of us, it is put there and we don't visit, so we don't even get to see it, we don't even get to review it. And I think that is why Madam Susan is emphasizing, please listen through, because majority of times we put it there and people will still call to ask us, please send us the presentation on email. Please send us this on email. Please, can we do this? We are kindly advising you, visit our website, go to InfoHub, go to public sector, where you will find this window, public education and advocacy, and go through all the bulleted things there. It will help you, it will guide you so that you can be able to get the 100% that most of you are looking forward to. And I can tell you for sure, for those who got 100%, if you ask them, majority of them visited the website, and they also ensure that end of every quarter, they followed up to check if their things were okay and they submitted the correct things. So up to there, I hope we are all clear on where to get the documentation. So then I'll take you to the first document, the form, that is the work plan. And as we go to the work plan, what I would like to emphasize, before filling in this work plan, kindly ensure that you have sat as a committee, you have discussed what you intend to do, you have sent it to us so that we're able to verify, to guide you, and validate and give you a go-ahead. Because this time round, if you don't do that, you meet a roadblock. You'll not be able to submit your work plan online. And the reason we're doing this is to help us, because we realized last year, some people were submitting the work plan as early as June 2022 this year. Already that tells you that the whole of the year, you wonder, what have we been working on? If now is when we're sending our work plan. So we want you people to send your work plan, as you have been told, by 30th, but please ensure that you first send it to us so that we can guide you, we can help you as we work towards ensuring that we comply and get 100%. Also note that as you do this, visit the explanatory notes. I've seen some people asking about if our policy is not complete, if we are still not yet disseminated our baseline, do we go to level 2, what do we do? That is why we are saying, do your work plan, send it to us, and we'll be able to guide you on what you need to do or where you are at. So when you go to our website, again, like I told you, you will find this form. And we are saying, as you fill in this form, you need to have gotten clearance from us. So this is what the form looks like. As you can see, the section where we have the email address. Kindly ensure that this email address is of the person who will be sending the work plans or who will be communicating. I know most institutions are using the secretaries. We have a few who are using the organization email, which we face a challenge because if you use info, if you use the CEOs, if you use the MDs or the principal, sometimes when you send feedback, I'm sure probably your CEO will see it, your MD will see it, but they might not be in a position to respond or to understand what is going on. So kindly ensure the email that you use here is for the contact person. And this time we are saying, as you'll be sending us your work plan, at the end of the work plan, please ensure you put the name of the contact person, the email
address of the contact person, the phone number of the contact person. This is because this is what will be in the database. And if you put any other email apart from the person that is on our database, then you will not be able to fill in the work plan. Please note that the email here is for the contact person, who will be the one sending the work plans, and the same person will be sending the quarterly reports. So once you put on that the email address, then you will move to the next section, which will ask you for the name of your institution. Again, ensure that you put in the full name of your institution. What we also realized, and sometimes it became a challenge, for example, if I was to write NACADA in short, and then in the next quarterly reports, I put NACADA in full, sometimes the Google document is not able to relate to that. So please ensure, like if it's NACADA, I will not put it in short form. I'll put the full name of NACADA so that when it is downloaded to the forms, it's able to tell that you submitted the work plan, you submitted your quarter 1, quarter 2, quarter 3, up to 4 without skipping. So please ensure that you do that. Then once you fill in that, it will take you to the next section, which will ask you for user validation. Again, I emphasize, ensure by the time you're reaching here, you have sent us your work plan, we have said it is okay, and you have indicated the contact person. The contact person's name, email address, and phone number. So that once you say yes, it will take you to the next session. When you are not a user validated person, you will definitely not be able to move to the next session. So please take note of that. So once you click yes, it will take you to the next session, that is section 4. And remember, if you're not validated, it will take you to section 3. And once you click there, then it will contact us that we need to check. So please ensure, beginning from today, send your work plans, we look at them, we tell you they're okay, so that you're able to upload with ease. Then, of course, you go to the next section, which now again continues with information about your institution. You will tell us the category of your institution, whether are ministry, state department, public university, tertiary. Click on the one that your institution is in. Then, of course, from there, it will tell us the parent ministry. Click on the relevant parent ministry that you belong to. From there, it will take you to tell us about your institution. You will need to tell us the number of staff in your institution. For those in tertiary universities, you will also need to tell us the number of students that you have. Then, of course, the contact person, which is the secretary or the point person. Remember, this is the person who receives this document. Again, I want to emphasize, for those of you who call us and tell us, can you send us our work plan? We did not receive a copy of our work plan. Please, the email that you provide, the contact person, that is where this work plan goes to. And remember, it is a Google form document. It doesn't come to your email like email from NACADA per se, like saying good afternoon, find attached. It is a Google document. So once you send click, a copy should be able to come to the email person of the contact person. So ensure that you give the email of the contact person, the person who will be the one submitting the quarterly reports, and the person who, once they get the feedback, they are able to take it back to the committee, discuss, or they can take action about it. So please take note on that. Of course, the telephone number and the email address of the institution. Again, I emphasize, as you send us your draft work plans for us to verify, at the end of it, please put the contact person, the name, the institution, the name of the person, the email address, and phone number, so that this, when you come to filling in your work plan, it will be easy on your part. Then from there, you'll be told to continue to the next session, which is section 5. And again, like we said, and Madam Susan said, The preliminary activities are not being scored, but they are key and vital. If you do not do them, then you will not be evaluated at the end of the year. So again, once you have picked your preliminary activities, you'll come and tick depending on what you have. For those of you who are forming new committees, you will click there. For those who are reconstituting the committees, you will click there. So it depends on where you are at with the preliminary activities. So just tick where you are at. And as you can see, we have also tried to guide you on what will be the evidence that is required. Because if you're forming a new committee, then we need the letters of appointment and we need your quarterly minutes committee meeting. If you are reconstituting, again, letters of the members who have been incorporated in the committee. But if everything is okay and yours is just to hold meetings, then the evidence we need for you is just the quarterly minutes to show that you've been meeting quarterly, either to plan or either to review what you have been doing as a committee. And remember again, you need to sign both the chairperson and the secretary as you'll be submitting this as evidence. Then from there, it will take you to the next session, which is one of still the preliminary activities, and that is sensitization of staff, their families, and students where applicable. Remember, again, you're required to do at least 2. It can be in person, it can be online, but as you do this, please ensure you submit the report and registration list. If it's online, don't send, like you have been told, the screenshots. Send through your ICT person. They can be able to help you to download the list, which you'll attach as part of the report. Again, select what is applicable to you as preliminary activity. If it's staff sensitization, if it's students, if it's staff and family, select what is applicable. Then we go to capacity building. When we say capacity building, this is where we're talking about the trainings, which are supposed to be done either for your committee or for the management and all that. Again, we are saying that it can be done as a core activity if it's a mitigating factor. And if it's done there, then you don't have to come and tick it here because you put it as an activity. So here again, if, like the example you're given, that it is lack of support for management as a risk factor, and you decide that your mitigating intervention is training the supervisors and managers, you don't have to click it here as a core activity, you will put it as an activity. But if it's not your core activity, remember it's a preliminary, tick any of the bullets depending on what is applicable to your institution. Then from there, it will take you to level 6, section 6. And section 6 is where you're supposed to fill in the core activities. Now, this is also a section where we were having issues, especially with people's work plans. And we're advising before you go here, please send us, sit as a committee, discuss what you intend to do, discuss even in which quarters you intend to do them. And as you discuss which quarters, I know the tendency is we usually shade the quarters on our work plans. But what we're saying, besides shading, allocate the percentages. Like you have been taken through, for example, an activity like undertake baseline is 30%. Now this 30% is the one we distribute in the quarters. Don't shade or just tick the quarters, but distribute the 30% in the quarters. You can start from quarter 1 to quarter 4. You can start from quarter 2 to quarter 3, depending on where or how, when you intend to do the activities. If you're not able to do an activity from quarter 1, kindly just put 0 because 0 is a number. Do not put 10 or 5, yet when you're asked to show what have you done towards the progress of this, you're not able to give evidence. So when you're filling in the core activities, the activity here, you will fill in what you have indicated from your work plan. And once you do that, for example, if it's the baseline, then you write their baseline. And then when you come to the next part that asks activity performance indicator, please take the indicators that we have provided in the explanatory notes, because that is what you need to have there. Do not put your own indicators. Like I'm seeing from some of you, you're already saying that if you're having committee, you will give us the memos, you will give us the invites. Kindly note, we do not need your memos. Those could be for your internal filing, but we need to have what you have asked for. If it's letters of appointments, if it is the signed minutes, if it's a copy of certificates, that is what you'll have there as the performance indicator. So please note that. Where we're saying activity one's performance indicator is basically the indicators we have provided. Just take them as they are and fill in for whatever activity you intend to do. Then the next section, which is asking activity one, quarter one target. This is where, again, most of us are having a challenge. Basically, this is quarter one. What do you intend to do about that target in quarter one? What do you intend to do about that target in quarter two? What do you intend to do about that target in quarter three? And what do you intend to do about that target in quarter four? So what you need to put is just the percentage. If it's, for example, baseline, like I've said, that is 30%, then probably in quarter one, you'll be starting with preparations. Like if you're engaging NACADA, for example, then that means you need to give some percentages. Again, oh, the voice is gone, but it's on. Iko sawa? Okay. Can you hear me?
The voice is okay.
Okay, thank you. So when we are saying activity one, quarter one target, if I was doing baseline, for example, then maybe I'll put something like 5% because this quarter is almost gone, but I know there's something I'll do about baseline. It could be engaging NACADA, writing emails, getting the questionnaire, something like that. So the 30% is what you distribute in quarter one, quarter two, quarter three, quarter four. So please note that. Don't put 150, 25. I don't know where people get. Okay. Okay. Sorry, these are technical things. In my place where I come from, we say technology. So you need to understand they are difficult. So as I was saying, make sure the 30% is what you put there. Don't put the 100%, the 50s, the 25. Kindly use the percentage we have given. It's what you divide between quarter one, quarter two, quarter three, and quarter four. And if you're not doing an activity in quarter one, please just put there 0%. Don't be shy of putting 0%. It will help you because definitely we know you are not doing anything in quarter one. And even when you be submitting evidence, probably the only activity you put for quarter one is what we'll check. So ensure that you do that. And that goes on all the way. Come to your second activity, write what your second activity is. If it's developing a work plan, please put there developing or review your policy. Put there develop or review of policy. Again, take the performance indicators as they are in the explanatory notes. Put them there. When you come to filling in the quarter two, activity two, quarter one target, activity two, quarter two target, activity two, quarter three target, and activity two, quarter four target, take the percentage. The 40% is what you distribute in those sections. So I hope that is clear and we'll be able to fill it all the way to activity three. The same, put there, if it's establish your support mechanism, please put there support established mechanism. Again, performance indicator, pick the performance indicators that belong to established support mechanism, put them there. When you come to distributing of the percentage, quarter three, activity three, quarter one target, activity three, quarter two target, activity three, quarter three target, the percentage, which is 20%, it's what you distribute from quarter 1, quarter 2, quarter 3, up to quarter 4. Then finally, when you go to your activity 4, fill in your 4th activity, which should be submission of the quarterly reports. Again, pick the performance indicators as provided in the explanatory notes, put them there. Quarterly submission is 10%, and it is every quarter. So this means in quarter 1, activity 4, quarter 1 target will be 2.5%. Then again, activity 4, quarter 2, 2.5, activity 4, quarter 3, 2.5, and activity 4, quarter 4, 2.5. Once you do that and you're done, you will be able to submit the work plan. So I hope up to there, we at least have a feel of what is supposed to be in our work plan. And I will also emphasize, please meet as a committee, discuss your work plan, send it to us at workplace@nakada.go.ke so that we are able to verify and to give you a go ahead to be able to fill in. And as you do that, please put the contact person's name, email address, and phone number. So from there, I will now take you to the next, which is the quarterly report. And again, this is also found back again to our website. When you go to InfoHub, public sector, once you open, you should be able to see this. And this is done towards when the quarter has ended. Please don't wait up to 15th to submit because you might have technical problems from your side or even from our side. Try and submit as early as possible so that even when we receive and we see there's anything, we are able to correct and give you support. And again, like Madam Susan said, if you can be able to submit your things on time, then it's easier for us to even give you feedback so that you know if you're on track, or you need to improve on something, or you need to change something. So once again, this will be what the quarterly form will look like once you go to our website and get it. And remember, the email address will be for the person who has been validated. So if you have not sent your work plan by the time quarterly reports are being submitted, then you might have a challenge in submitting the online quarterly report. So please ensure that your work plan is validated and your work plan is submitted by the time you're doing your quarterly reports. So of course, you write the email address of the person who is reporting, you write the name of your institution, then from there you go to section 2. As you can see, section 2 is asking you if you have submitted your work plan or not. If you have submitted, then you click yes, and it will prompt you to go to the next session. If you have not submitted, you will click no, so that we are able to assist you on how to go forward. Because if you say yes, and you go to the next session and you fill in, it might not accept. So kindly take note of that. So once you do that, it will take you to the next session, which is section 3, and that is what you receive. If you have not, you will be told to send your work plan so that we can be able to verify. So again, the next session is about the institution. You should give us your information, category, the contact person, the telephone number, and reporting period. Now, just in this section, we also realize that some people, I don't know how to say, they forget, or I don't know what happens. They don't send us quarter 1 when it's required. Then when it comes to somewhere quarter 2, then they send quarter 1 and quarter 2. Kindly ensure timely quarterly reporting. Because when you send quarter 1 in quarter 2, then you're likely to lose some marks on that. So please ensure when quarter 1, like now we're going to be ending in September, before 15th of October, you have sent your quarter 1 report. So you click there and then it will take you. Yes, we shall give you the deadline of when to submit, but don't be worried about that. We are dealing with the work plans, and we're saying by 30th, the work plan should be there. Quarterly report is 15th of the subsequent month. So please ensure it is timely. For work plan, 30th. If by 30th you don't, then you lose some marks for not being timely. So please take note of that. Then from there, it will take you to the next session. Of course, it will start with the report on the preliminary activities. We've already put them there for you because most of you will be having what you're doing. So you just need to tell us what it is that you have done in that quarter regards to your preliminary activity. And then, of course, we're asking for progress of activity during the quarter. How much were you able to implement? What were you able to do? And remember, again, this is to help because sometimes, like the previous years, people are asking us, what if we are not able to achieve an activity that we had put for quarter one, but in quarter two? This is where you need to explain so that as we read this, we're able to understand that you had indicated to do this activity in quarter one, but due to various challenges or whatever it is, you're not able to do. So please ensure that you put that in writing so that as we read, we're able to understand that you are not able to achieve it, but you have pushed it to the next quarter, and we hope you'll achieve it. So kindly ensure you put notes on the progress that you have done during the quarter. Then, of course, the indicators of what you've been able to do and the evidence that you are sending. Again, it is supposed to be complete evidences. Last year, we had told people, please, if you're doing your policy, don't send every quarter the draft, the draft, the draft, the draft. Just ensure that by the end of the year, you have sent the final document. So if it's a working document, you don't have to send it to us at that particular time. Just make sure you put there that the document is not complete in the explanatory notes in the brief progress, and then you will send it once the document is done. Then again, we come to sensitization. You tell us what you have done about it. You provide a brief description or notes on what you have done about sensitization. And of course, you give in the indicators that you provide for that activity. You go on to the third, do the same for capacity building. If it was training of your committee, if it was training of the managers and supervisors, if it was training of student welfare, put it there, tell us the progress, and tell us the indicators or evidence that is available for what you have reported. Then once you're done with that, you will move to the next section. This is the section where we have the core activities. So again, remember, we are writing the activities as we have written on our work plan. I know from last year, people are asking us, why do we have to keep on writing the way we wrote in our work plan? Why can't we just write what we've achieved in quarter one and then send it, or what we achieved in quarter two and send it? Remember, this is supposed to be a monitoring tool. So we need to know what you had planned, what you had not, what you have been able to achieve, and what you have not been able to achieve. Because, for example, if you say you're just putting activities for that quarter, what if there's an activity that you miss out the next time when you're submitting, you forget to put that activity? So please ensure as you write these activities when reporting, the way you have put them in your work plan. If your first activity in your work plan was baseline, then as you report, your activity one still remains baseline. So you put it there, then you tell us the progress that you have done for that activity during that quarter. Indicators that will show that you have done that activity, you put there. Then we come to performance of activity one for the quarter, self-assessment of the progress. Remember, you have put a percentage. And please be true to yourself. If you had put something at 10%, and for sure you know that you have not done the 10%, give yourself 8%, 5%, and say that it is not complete. Because again, from when we are receiving the appeals and some people are complaining about their scores, they are saying internally they assessed themselves and gave themselves this, but we have given them otherwise. So please be true to yourself. If you have not completed your 10%, just award yourself your 5, your 6, your 7, your 8, depending on what you have achieved. And then you go there and you'll be able to explain, because you can see we have a section where you will give us the variance. So for example, if your activity was 10 and you've done 5, of course, it means you'll be left with 5. And we have a section where you can comment on the variance or the challenge that was there. So please do not give yourself full marks and you know you've not completed the assignment. So you do again the same for activity 2. If your activity 2 was development or review of the policy, you write it there. You provide what you have done for that quarter. Again, put the indicators that will show what you have done for that quarter. Give yourself assessment percentage depending on that. If, for example, in that quarter you had said you're doing 10%, again, if you are sure you have done the 10%, well and good, put 10%. But if you have not, please be true to yourself, be honest, and give yourself a percentage that will show what you have done. And you give the target what it was. If you have a variance, you also say, and if you have a reason for the variance, please indicate there. For some people, they might say that, an example I give, the people who sent us draft policies by the end of quarter 4. They send the draft policy and we still told you your policy is not complete, you need to complete it. This is the section where you say your policy is a draft form because it's awaiting management approval or whatever it is that is giving you challenges or why there's that variance. So that even as we evaluate, we are able to see what is happening and we can understand where you're coming from or where you're heading. So please ensure you do that. Then, of course, you go to activity number 3, the same. What if your activity number 3 was establish support mechanisms, right there, establish support mechanisms. Come and give us the progress for the quarter. Indicate what you have, the indicators or evidence to show that this activity has been done in the quarter. And then, of course, give yourself the percentages and what you have intended to do in that quarter. If you have any variance, you need to indicate there. If you don't have, then just put 0 because you need to put a figure there. Then if you have comment, if you have no comment on variance or challenges, then also just write a name so that we know that you didn't face any challenges or any issues at that point. Then you go again to your activity number 4. Just like you put it in your work plan, activity number 4 should be submission of quarterly reports. Put it there, say the progress you have done for the quarter, the indicators. Of course, at end of quarter 1, the indicator will be the online submission that you have done, and you should not have a variance as in that quarter, but of course, subsequent quarters you will have, and then you just indicate the comments and the like. So once you're done with that, it will take you to the next session. This is the session of uploading evidence. Again, we are advising, by the time you're filling in this form, you're better off ensuring that you have all your evidences put together in a folder that you have labeled. If it's NACADA, I would say NACADA quarter 1 evidence. So that when it asks you, just say yes. And once you click yes, then it will prompt you to the next session that you describe what it is. And then you click at the place where you're told to add file and then be able to download the folder. Please ensure that you try to zip your documents in a format that can be opened. And also, as you do that, for those who have, for example, many registration forms, please try and put them into one PDF document vis-a-vis sending each registration form individually, because then this will limit you in the space. You will find people calling us and telling us we don't have enough space, or the form is refusing to accept more than 10 evidences, because ideally we are hoping that if it's things like registration lists for all the activities you've done, put them into one PDF so that it's just one document saying registration lists, so that we don't have 5 registration lists you want to upload individually. It will take space. And that is why you find some of you are saying our evidence are not enough. So please ensure that you are submitting the right evidence, because when you submit the right evidence, then it should be enough. The space is enough. Again, go to our explanatory notes, and what we say as indicators as evidence is all we require. An example I'll give you, if one of your activities was about the committee, if you're sending us copies of letters, if you're sending us the signed minutes, if you're sending us copies of certificates, what you can do for the appointment letters, you can put all the appointment letters in one PDF document. Then send for each member individual, what do you call it, individual appointment letters. Because if you have 6 members, already it is taking 6 spaces in the section for uploading. So something like copies of their letters, you can put it into one PDF so that it just comes as one document that reads appointment letters. Then again, for the certificates, you don't have to send each and every person's certificate individually. Put them into one PDF document so that it's just one document with all the members' certificates. And that way you'll have more space and you'll be able to upload your evidence with ease. So once you're done with that, then it will prompt you to submit. Click submit. And once you do that, it comes to us. And remember, a copy goes to the person whose email address was given at the beginning. So I hope we are better. For those who are not able to understand, we are better, and we are always here to assist. So the next document I also want to show you people and just share with you is the EAP monitoring tool, which is also again found on our website. And as you can see, it is called EAP monitoring form. I know on guidelines or the explanatory notes, we are saying utilization report. It's one and the same thing, because it's the form that will show us how the EAP has been utilized. So it is found there. It is the EAP monitoring form. So once you go there, I'll just share with you in a moment. Nimeanza kumisbehave. Mouse. Matthew, my mouse is misbehaving. Nakataa kurudisha, nataka kushare. Kama inaonyesha. So this is what the form looks like. But it's not showing this side. This is what the form looks like. Some of you may choose to download it and fill it manually, but it is something you can just fill and then save and send it to us. So you go there, write the name of your institution. Once you write the name of your institution, then you come and report which quarter. Again, when you put your cursor there and click, it will give you the option of check. So you check. Once you check, then this is what will come. As you can see, mine has checked. So once you check, it will show you that you're reporting for that quarter. So please ensure that for each quarter you check. Like you are told previously that every quarter you need to submit what you have done about EAP. So you check that. Then you come and tell us the services available depending on your institution, if it's in-house, if it's scheduled, if it's hybrid. If you have any other, again, just check, click there, then tick what is relevant and what is applicable to you. And it continues all the way. You give us the details. If you're sensitized, you say yes, you check the type of problems that are there, you check whatever is applicable to the issues that you had in your organization. You continue, you're asked to identify the method you used. Was it self-referral? Was it informal? Was it formal? So again, the same, you check. When you're asked the number of students referred, you come there, type wherever number was referred. If it's staff, the same, you type and continue the same with the form. If you have those who have utilized your counseling services, like some may be internal, then again, you need to type there the number that has been have utilized your counseling services for both staff and students. And then if you have any person who went for rehab, again, remember, just type the number that went there. If you don't have anybody, you also feel free to say that you do not have anybody who sought the services or was taken for counseling. So you can just say nil, so that you're reporting that at least you are doing something as a committee. Then, of course, the job category, depending on who uses it or who was referred, you can just put that. The issues that were talked about, you can put there. Then, of course, in terms of gender, whether it's female or male, you put there. Age, you come and click and tick. Who was helped? Is it the staff? Is it the dependents? Then you also come and indicate there. If you had any challenges while implementing, you come and tell us here the challenges. So that when we read this, we are also able to see what you're facing in terms of EAP and how best we can help you with your EAP services. So please ensure that you visit our website, get all these materials, use them where applicable, and send them back to us. So that is it from me. And now we'll be going to the question and answer sessions. Questions and answer session, you can put up your hands and then mute when you're asked to ask your question. Thank you.
Okay, so let's start with Margaret Kamoni. Margaret Kamoni, and unmute her. Yes, Margaret Kamoni, can you unmute and speak? Can you unmute her?
Sorry, I had put my hand up. I just wanted to raise the issue of sound before. Sorry.
Do you have a question? All right, Oliver Mulama. I hope the ones whose hands are up have a question. So if you had carried up your hand for some reason which has already been addressed, kindly put it down so that we only ask those who have something to say. Oliver Mulama, go ahead.
No, I just requested that you share the presentation. That's all.
Please note that we have said over and over that the presentation will be posted on the website. So thank you, Oliver, but we have said over and over, it will be posted on the website. So if that is your question and your hand is up, kindly just put it down. That is why Rita was showing the website. That is why we will put the recording, we will put the presentation, and we are going to update other materials that we said are available for you. Okay, so next we have Rose Ngunjiri. Unmute and go ahead. Magutu Onchoka. Magutu, unmute and speak.
Yeah, my first question is that in the last financial year, we trained a number of the committee, but we did not meet the threshold as provided in the guidelines. Now, in this year, this financial year, are we again supposed to train some more committee members? And in that, shall we provide some of the evidence, maybe let's say the certificates that we had trained in the last financial year plus what we are going to train in this financial year? Number two is a concern that whatever you share as the presentations are mostly visual, but not audiovisual. So the audiovisual ones are important, such that those of us who are getting the challenge of the network will have to follow exactly what you are presenting today. Number three, we did a baseline survey in the last financial year, but there are some steps of the baseline survey which need to be done, which were not done in the last financial year. When doing the work plan, shall we indicate that we are starting again with the work plan, and what shall be the scores having done part of it in the last financial year? Thank you.
All right. Okay. So, Magutu, thank you for your questions. You have already mentioned you did not meet the threshold. And so in your work plan, you are going to check that you still need to train committee members. And so what you submit are the certificates for this year. Yeah, the certificates for this year. Okay, so that will suffice for you. Audiovisual, I've just mentioned that we are going to submit both of these things. This recording is going to be on the website. Then the presentation will also be there. I hope that answers your question. And now when it comes to the baseline survey, you also mentioned you did not complete. So remember, what has not been completed is what you proceed with, so that if it's analysis that is not done, you need to complete. So you're not going to say conduct baseline survey, but to complete. Yeah, whatever it is that is left. So you see, when you share with us your draft work plan, we shall look at it, and then we will also respond appropriately. All right, so I hope that answers you. Let's see here, next one, which is Stella Cavata.
My question is regarding the preliminary activities, especially for the level 2 institutions that are at level 2. I noted in the uploading of the work plan, there are several activities that you have to say that you will do, especially on capacity building. So if for like in our case, we already did the training of managers and supervisors, and we already trained our peer educators, are we able to not select anything under that preliminary activity, given that it was achieved in the last financial year?
Exactly. Exactly.
So that question can be left blank.
Yes, that's why you can see there are options there.
Okay, just wanted to confirm that. Thank you.
All right, thank you, Stella. Now, next we have Sam Mayo.
Hello, you can hear me?
Yes, go ahead.
All right, mine are two questions. One is, I saw part of the attachments is a costed work plan. I don't know whether you want to share a template so that for purposes of standardization, we present the same work plan in terms of the costed work plan. And then secondly, when does a baseline survey effective from, if you do one, how long will it last before you undertake another one? Those are my two clarifications.
Okay, so I will answer your question, the first question, and the research department is on board, so they will be able to answer that. So in the case of work plan, we are not providing you with a template. And I don't know if this is your first time to submit because you are supposed to indicate, like the draft that you are sending us, you will indicate if there are cost implications and how much you have actually allocated. Because if it is sensitization, you are the one who knows what you are going to sensitize people on and whether you are going to do it internally or you are going to engage somebody from outside. So that is why we said resource. When we talk of resource, it's not just about money, but if you can also use internal, what is internal, then that should count. Okay. So it's not like we are sending you one so that you just fill in. Okay. But as we engage with your draft work plan, we shall tell you whether you have put it in or not. All right, so I will give who is here? Steve Kimani. There's a question on the survey.
Hello. Good morning, all. Please repeat the question on the survey.
Oh, the question is asking how long the survey should last before another one can be done.
Minimum of 3 years. So any between 3 to 5 years should be okay. So if you do your survey, say now in 2022, you use the time after 2022, at least 3 years before you do another one, unless maybe you have had some major changes. Like we've had some organizations that maybe previously they had one office or headquartered somewhere, and then now they have opened many county offices. So their staff establishment has changed drastically. So, or maybe there has been massive recruitment and you feel that you need to collect data fresh. Other than that, I think you should maybe work with 3 to 5 years. So if you have implemented all your all the things that you needed to implement within the 3-year period, then you can go ahead and do another one. If you haven't, then you have maybe up to a 5-year period to do another survey.
Thank you, Kimani. And remember that when this indicator was brought back to the PC, we indicated that any survey that was more than 5 years, you are supposed to do another one. So the subsequent ones, it means you're doing follow-up surveys, not a baseline. Again, it's a follow-up survey. Okay, so Mayo, I hope you have been responded to. And so next we have Alphonse Kahindi. Go ahead. Alphonse Kahindi. Unmute yourself. In the way forward. Kahindi, you are not unmuting. Let's move to Jeremiah Makairo.
Hi, can you hear me?
Yes, go ahead.
Thank you. Your sensitization was well timed. I was just wondering, when we fill in the quarterly reports, it's a little bit tedious for us to keep on filling in the work plan targets again. Is it possible for the system to be made in such a way that since the work plan targets do not change, that they are there so that as we just start filling from what we have done in that quarter towards the achievement of that target? Thank you.
No sound. Susan, you are remote.
I'm not.
No sound.
No sound from. Funny, but you know, okay. I hope now I'm back. No. Am I back? Yes.
Okay, yes, you're back.
Okay, so Pamela Kaifuru. I can see your speaker is on, but I can't hear anything. So we move to Joshua Nzeka. Joshua Nzeka. All right, so can we go to, huh? You're gone.
Can I be heard?
Yes, now we can hear you.
Okay, I also join the rest of the team to appreciate the presentation by Nakanda. My own is just a recommendation if it is allowed. Are we allowed to make recommendations?
Yeah, sure, why not?
Okay. Okay, your presentation was quite elaborate. I was in from the beginning. I feel I need to make this comment because when you look at what is expected of the committees, is quite a lot of work. And I said, knowing that especially ministries and departments, some of them don't have a lot of staff. So you find one person could be in several committees of the cross-cutting issues, therefore becomes a bit overwhelming, considering that this is also not the core duty of this person. They have NJD as well. So my proposal is maybe going forward with the time and considering the fact that when we look at the country and see the challenges, the health challenges arising from substance abuse, it's not getting better. It is quite a challenge, and there is increasing trend in terms of mental illnesses that still need to be addressed alongside substance use. And I feel going forward, maybe the institutions, including Nakanda, that are coordinating agencies for cross-cutting issues, need to be able to maybe negotiate or advocate for a staff establishment of sorts of people who are dealing with these cross-cutting issues because of also changes of the committees frequently because of either deployments or retirement or such like things. Logistically, it may be difficult for somebody to be in the committee for the entire 3 years. So there may be changes in the committee. But if an office is established with the time, I say with the time because I know at one point when we were looking at issues HIV, we said, this is it's not your core duty. But then you look at the challenges and you see the need to actually consider this with the time, especially knowing that health matters are getting more demanding. That is my recommendation. I also want to say for the committees, I would recommend also, knowing that this work is too much, is there a way that they can also maybe be being debriefed? Is there a likelihood that them being overwhelmed could also impact on their wellness? Being overwhelmed by a lot of work that is not core, could it impact on their wellness? Is it possible to see how then these committee members can be supported? And I think that forms my in comments in this meeting. Thank you.
All right, so thank you, Pamela. Like she said, she was making recommendations. So that is noted. That is noted. I'm going to take 5 people first, then respond. And please, if we have already given you a chance, then just put your hand down, because I'm seeing some hands which had already been. If we had already given you a chance, just put it down. So Joshua Nzeka, let's hear from you. Please unmute and speak.
Hello, everyone.
Yes, hello.
Yeah, sorry, I couldn't be heard the other time. My concern is, I've seen some of the people like me, we were unable to upload the evidence, even for some of the quarters. Like I did almost last quarters when I was able to make it. Is it possible to resubmit the evidences so that we can be reassessed? I'm from Cape.
Okay. So that is, let's hear from the next person. Next we have Joshua. No, John Onyoke. Oliver already gave him my chance and he said he didn't have a question. John Onyoke.
Yes, hello. You can hear me?
Go ahead.
Okay. My question is, and it is related to the previous comment that my colleague has just mentioned about the transfer of committee members. We realized that we had trained some of our members and some were transferred from within the place of work, and others actually retired. Are we allowed to do a fresh appointments, or we shall remain the few members that are on board?
Okay, so let's hear the next person. Oliver Mulama, I already gave you a chance and you said your question was answered, and I can see your hand is up again. Veronica Sunda. Veronica Sunda. You know, if your hand is up, then we need to also get moving. Veronica Sunda. All right, if you cannot speak, then please use the chat. Joseph Adipa, I don't know if you still have a question because we've already responded to several on the chat. Adipa?
Hello.
Yes,
good afternoon.
Good afternoon.
Yes, I have 3 questions. One is the case of the processes through which the performance contracted, that is the PC, is supposed to go. And you may find that at times, the time of review, the time of the final PC that now we have to implement, in which NACADA is part, the review maybe takes late. So you find that like last year in the financial 2021-2022, a case where our PC was reviewed in the final part was in December 3rd. That means the first quarter and the second quarter, we had nothing to do. So how does the NACADA take into consideration those quarterly reports that had not been submitted, like quarter 1 and quarter 2, because the PC was reviewed late? Number 2, the questionnaire that is provided is actually too long, and in some institutions, the trainees feel like they're doing an exam. So is there a way in which it can be reduced to even in the mode of production also it takes much. Then the last one is the cost. Some of the implementations that is required is very costly, like the charges that the officials from your side you charges, they're very high. I think the alternatives, either we have the face-to-face in-house or the online, and the online is 3 weeks. So my question is there an alternative in which an institution or a tertiary institution can conduct the training of the committee or the staff and the trainees, which is not those, that is not going to cost so much. And again, if it is online, it is not going to take 3 weeks. Thank you.
All right, so before you have asked the things which I think have already been responded to you on the chat. Okay, so I will respond, and then for the questionnaire, then research again will respond. Now, well, if you ask for evidence, if you did not upload your evidence by July 15th, we have already finished with that. And I believe in the last PCB meeting, people are given up to 26th for appeals. That's already done and closed, and we have moved forward. You cannot submit evidence now. For the last financial year, we are almost ending Q1 of this year. So if you did not, then it is very unfortunate for you, for those who still have evidence that you're keeping, because even in the middle of in June, we also sent a reminder that please note that you need to submit your evidence by this time, and this is what we'll be looking for, and so on. So it is actually upon you to do that. So it is too late for you to submit. Now, for the case of committees, now, Joan, I am privy to your committee even dropping out from training. So I don't know who you trained because they dropped out. They basically did not complete training, right? But remember that in the training, you also say the people who are supposed to be in the committee. There are certain people who must be members of the committee for the very reason that the roles that they play. So that is already specified. Now, if you have new committee members, remember, just like I responded in the first instance, check the box that you will be training other members, and then let them be trained. And before we finish on the way forward, we'll be telling you about what will happen with the trainings. Remember that we have 3 ways of training, actually 2. Now we have 2 ways of training. There is online, which is free, and it's going to be conducted by regional offices. We are going to give that as part of the way forward as we finish. The 2, there is the in-house. So even those who do not want to undertake online training, then you have in-house. The in-house for committee is 5 days. So the reason why you have the training running for 3 weeks is because you're talking about it's the same training that is done from 8:30 to 5 every day for 5 days. Is the same training that you get for the 3 weeks. That is why you find there is synchronous and asynchronous. So you will not be able to eat your cake and have it at the same time. And you don't train every day. So the training is comprehensive. It takes care of a lot of things. You do exercises. In the in-person, this would have been covered there. But if you are doing it virtually, then it means that that is how the training is done. Now, you also need to know that these trainings are international standards. So this same thing is done across other countries. So if you are undertaking that training, that is how it is also done. So it's not a sensitization, it is a training, and you get the same benefits as the person who is doing in person. The only difference is you are not able to chit chat with the others and take a walk down the beach and so on. So that's the only difference. So in terms of costs, so even those who are thinking, oh, it is too expensive to train, remember there is online, which is free. Yeah, and your management will be very supportive of you for online compared to even in-house. And in many cases, in-house, you're the ones who say, I want to go and train in Naivasha. If you're going to train in Naivasha, then it means you meet the cost of going to Naivasha. Okay, so there will be, you will not be able to see a training schedule because, like I said, we are going to say this at the end. We have our regional officers that will be conducting this, and they will get in touch, those who will be in need of those trainings, and then we'll see whether it is being done virtually, or it is being done by in-house. And remember, if you choose in-house, then it means you meet the cost, depending on where you have gone. Because if you decide you want your training in Dar es Salaam, then it means you meet the cost of going to Dar es Salaam. All right, let's Kimani, on the questionnaire, you can respond to that. Remember, you can also use the chat for the questions because we need to also conclude this sensitization. If your question is already answered on the chat, please do not carry up your hand to say the same thing because some people here have already been responded to on the chat. All right, Kimani?
Okay, thank you. So for the length of the questionnaire, I think maybe when you print it, it may look long, but remember you are mostly just, if you are using a physical one, you're just selecting yes, no. And on average, if you're using a physical tool, you'll spend about 15 minutes. Remembering also that there are a lot of skip patterns in there. So the size of the questionnaire may look intimidating, but the amount of time we have from our experience that people are spending using doing the physical is about 15 minutes. If you're using online, it will be faster, even as little as 10 minutes. And what we have seen from conducting this survey is that a lot of staff will, you may face some resistance as a committee. You know, when you go and place a questionnaire in front of somebody and he's looking at it and it looks like a big document, they may not feel, they may feel like you are giving them extra work. But if they could just concentrate or give it like some maximum attention, I can assure you it won't take them it wouldn't take anyone 20 minutes to fill that questionnaire. So it's in our opinion, it is not too long. And remember also that you need to cover all the areas that you need to have information on so that you can put in place interventions that will be effective and guided by data. So I hope I have answered.
Okay, so thank you. And I'm only going to take 2 more questions because we need to also bring this to a close. Yeah, I know Joseph also said about the issue of Q1, Q2. Even if the whole process is approved in December, you already know in July there are certain things because everyone receives the same cycle. Like right now, you already know what is it that you are going to do, and you already know. Even right now, there are many people whose PCs have not been signed. But the thing is, you already know in HIV, this is what I'm going to do, in ADO, this is what I'm going to do, and you know that you're supposed to have quarterly meetings. So please take care of that. Just like we have people who decide on their own to go level 2. Without consulting ACADA, they've not done anything previously, they move themselves there. And it is very clear that you need to engage with the lead or the specialized agency to be able to do that. So I will take a question from Maurice, and I will take a question from Florence and Musonga, and I hope there are not things which have already been responded to. If you have any other questions, either use the chat or write to workplace at NACADA, or you can even call the landline, not cell phones, landline, so that we can respond to that. Okay, so Maurice, unmute and go ahead.
My question is very simple. So I put it on a chat, but I have not seen the answer. The question is, we developed a policy the last financial year, but from your assessment, we didn't submit the letter of engagement and the minutes of engagement. Are we treated as having the policy or not? That's one. Second question, although it is specially answered, was we had we did a baseline survey in 2020, 2021, but last year we recruited quite more than the population that was there during 2020, 2021, and we thought we need to do another survey. Is it necessary or not? Thank you, Madam.
All right, thank you. Let's hear from Florence. Florence, unmute and speak. Florence, I can see you have unmuted, but no sound. Okay, so Florence, we can't hear anything from you, although you are unmuted. So, ladies and gentlemen, we want to bring that to a close. Like I said, people who are carrying up their hands are things which either have been responded to or not. Because for Onyango, you don't require a letter of engagement in policy. So policy, it is either complete or not complete. Baseline, Kimani has just responded about the baseline. So that if you have recruited new staff and you feel that this is, you need to do another survey because it will not reflect the true position, he said, go right ahead. So check it in and please do it. Okay, so as we wind up, if, like I said, if you have any other queries, because the others could be specific to your work plan, send a copy of your work plan and we shall look at it. Okay. So now we've just done the questions. So what is the way forward? The way forward is that you need to submit your draft work plan to this email address. Please don't call and say or info. There are people who still send things to info, to the CEO, and we are saying send your work plan here. Workplace at NACADA. Do not ask again that I cannot, the online platform is not active. We've said it is not active. It is not active. We are confirming to you that it is not active. So what you are supposed to do is to submit your draft work plan to Workplace at NACADA for verification and approval before online upload. What we are saying is that you will not be able to upload if we have not verified. All right. So as you upload, once we verify, we'll say, please submit the name, the email, and the telephone number of the person who will be doing the uploading. So that it's going to be in a database, and that is a person who will get the go-ahead to submit. Remember, the deadline for online upload is 30th of September. So please, you have a whole month to engage with us on your draft work plan, and so that you can file it before then. The other thing is to do with the trainings, because I can see people are saying, oh, who are the people who are doing the trainings? Well, other institutions, we've said there are no other institutions. It's only NACADA who is training on this, because we have made a shift. Yeah, we still haven't had people there who are going to conduct this training. So these trainings, the committees, trainings that are done by NACADA, is the committees. which will be done by the regional offices. And this information again is available on the website. So if you are in Nairobi County, whether you are an MDA or a tertiary institution, you will be handled by Nairobi region. And we are going to provide that email. We are going to provide that communication as we do the areas, as we give you the go-ahead, then we'll also let you know these are the region that will be dealing with you. On the other hand, the regions also have your contacts, and therefore they will reach out to you. So managers and supervisors is a training that is also done by NACADA. Remember this, we are now doing trainings which are based on a curriculum. So that is why these trainings are not being done by anybody out there. The student welfare staff is also a training that is conducted by our regional offices. The peer educators is also conducted by NACADA, and that is done by counseling and rehabilitation. So you will be guided according to what you have. I've seen some people suggesting, oh, we need to have WhatsApp and so on. That is something that will be done by the regions. Yeah. The people who will engage with you, if they choose to have what is up, then they will have what is up. For us, we only have WhatsApp when we are doing online trainings. And the moment we finish, we say bye-bye, end of story, and we move on. So please align yourself to the website. That is where things are found. They will not find you in your email. Even today, after we shared the link, there are people who are still asking for the link, which has already been sent. And sometimes people ask before they even look at it, they check on the email. The other thing is about sensitizations, because there are sensitizations that you need to do. There are some that will be conducted by NACADA, meaning that you can reach out to NACADA to do the sensitizations. It could be on alcohol and drug abuse, it could be on positive parenting. It depends on what is coming out from your survey. It can also be done by your EAP service provider. So if your EAP service provider is NHIF, it means NHIF should be able to conduct that sensitization based on the services that they provide. Yeah. If it is by Jubilee, for example, Jubilee Insurance will be able to do the sensitization as an EAP service provider. In any case, they're the ones who are providing the services. Or any other party or consultant that you choose, as long as it is content appropriate. Because, for example, if the sensitization you require is on financial management, certainly NACADA cannot be conducting your sensitization on financial management. So it means that you engage with another party that is going to do that. So I hope that is clear with regard to trainings and also sensitizations. So our regional offices will organize for sensitizations, at least 2 sensitizations within the year, and they will contact you. So I hope that is clear. If there are any other questions, please now let us use other forms of that. So thank you so much, everyone, for being here. I hope this has been useful, as the others have mentioned. We shall share the presentations on the website so that you can access. If you have any questions, feel free to reach us via email. We do better on emails or on the landline. If you call me on my mobile, chances that I will not pick are very high, like now. Now that I've been talking here from 10 o'clock, if you called me, what are the chances that I will respond? Certainly not. So that is why, but if you use emails, it is easy to be responded to. So thank you so much, everyone. And that brings us to the end of our session today. And if you need to talk to somebody on alcohol and drug abuse, call our hotline, 1192, and you can speak to a counselor. Thank you so much, everyone. And please do send your work plans starting now. I know there are those who sent, but we wanted to deal with this first so that if there is need for you to correct certain things, correct them and resubmit. So you are at liberty to leave and have a blessed afternoon. Bye-bye, everyone.